Well, I'm so glad that the Senate passed, and as you saw, a bipartisan way, the 340B enforcement bill today. Despite the wide-ranging nature of the discussion, this was a really simple bill. It simply says that Big Pharma needs to obey the laws that the federal government passes and that the state of Minnesota passes, and they need to provide low-cost medications, as they are obligated to do under federal law, to our safety net hospitals for their operations that sustain patient care. Hospitals have never been in such a critical situation in our state, and 340B funding is essential to their ongoing operations and the way they care for Minnesotans. Without these funds, Hennepin County Medical Center would close, rural hospitals across our state would close. So I'm very grateful that both Democrats and Republicans supported that idea today and passed it across the Senate floor. I hope that it can pass out of the House as well. This was a David versus Goliath moment. Big Pharma spent $1 million a day in media leading up to this vote, trying to distract and confuse legislators about what this bill actually does and what the 340B program does for hospitals in Minnesota. We showed that here in the Minnesota Senate, the truth prevails, and we did a good thing for hospitals. And with that, I'll let my co-authors speak if they are interested.
Well, thanks everybody for being here. I represent the most rural district in the state. My name's Grant Hauschild, and I have several frontline rural hospitals that have talked to me about the importance of the 340B bill, because we have rural hospitals, 40% of which are operating in the red across our country. And with the big, beautiful bill that happened at the federal level, we know that those Medicaid cuts are going to disproportionately impact our rural hospitals most. And the 340B program is very simple. It is meant to help serve the places that serve a disproportionate amount of Medicare and Medicaid patients to make up for those costs that they don't get reimbursed. So we know that this is a critical program. We just need enforcement language to make sure that they follow the law here in Minnesota. We've seen this in other states. When enforcement language is added, Big Pharma follows the law and makes sure that this program makes sure that the hospitals get the benefits that they deserve so that they can stay open and provide essential services across the rural areas that they serve. And with that, I'll pass it to Senator Kupek.
Thanks. You know, when we first took up 340B a couple of years ago, I met with the Essentia Hospital in Detroit Lakes. It is the only hospital I actually have within my district, and they explained to me how crucial this program was, up to maybe $1 million a year of income for that hospital. And we're hospitals in rural areas that are marginal at best, many of them not having any kind of profit and being underwater. It is a crucial program for those rural hospitals that they have this lifeline and this source of money coming in to keep those hospitals open. So without this 340B, we would just see rural healthcare diminish even more. We're already under the big threats, as Senator Hauschild mentioned, about H.R. 1. We certainly don't need to add on by taking away 340B coverage.
You said on the floor that you're somebody who works at a hospital. You know very well how hospitals spend these profits. Could you just speak to that more? I mean, how do these usually get spent?
So the intent 30 years ago of passing 340B legislation was making sure that safety net hospitals had a funding stream to perform their essential activities in vulnerable communities. And what I see as a practitioner who walks through the halls is I see that in a very human way. I see addiction specialists treating people with deep addiction. I see physicians caring for people who have been through motor vehicle trauma. And I think that's a direct result of the fact that we've sustained hospitals, critical access hospitals, with a 340B program.
Senator Westrum's asked on the Senate floor whether you have any evidence that pharmaceutical companies, are flouting the program. Could you say more about that? Do you have any idea of whether pharmaceutical companies are either flouting the program or simply only working with one of the contracted pharmacies in some of these rural hospitals? I mean, what data, if any, is out there about how much more money these hospitals could get if there's an enforcement provision?
I think, so the list that you heard Senator Hauschild read, those are pharmaceutical companies who have policies that are in direct violation of 340B laws. So it is either, as you say, that they will not deliver to contract pharmacies or other mechanisms where they're simply not going to fulfill their obligations under the 340B law. And I'd have to go to each specific one and work with research to get you specifics. So.
Could you connect this to, everybody's been hearing a lot about HCM, so can you connect this to the issues that are going on there with their financial situation and just what this might mean for that?
Yeah, I mean, and this isn't the fix for HCMC. Senator Murphy was correct that we need to get to a bigger fix for that institution and a statewide fix, in my opinion. But they certainly don't need this additional blow. You did hear on the floor today that they get $100 million in 340B funding each year. If pharma was to shirk that obligation and they were to lose that funding, you know, that would just be another a brick in the wall that they would lose. So.
Senator, we're expecting a hearing on the House side here on Thursday as it pertains to HCMC here, potentially here. What is the Senate prepared to do in terms of support there?
Well, you know, I think we set the standard for how this is a bipartisan issue. You see people who represent Moorhead, you see people who represent the Iron Range saying that this is essential for the health of Minnesotans, for the health of our beloved hospitals, and surely my colleagues in the House will see the same in a bipartisan way. I know that pharma is lobbying aggressively. I know that individual legislators are being targeted because of this vote. And I just ask all of my colleagues to stand up with courage in this moment and deliver for Minnesotans.
Natalie Zalesnikar, who wrote the House 340B bill, she says she doesn't want an enforcement provision. I mean, what are the chances of this bill getting passed in the House? What are the chances of HCMC or any kind of Senate healthcare activity getting passed in the House this session?
I just think, you know, I never give up until it's time to give up, until the vote is over. People really need to see how difficult hospitals' situation is right now in this moment in Minnesota. And to sort of abandon them in this moment as $1 trillion in medical assistance cuts are coming from the federal level would really be a mistake. It would be an abrogation of our duties as legislators to care for our constituents. I am hopeful that Representative Zalesnikar specifically stands by the bill that she signed on as chief author, because that is the intent and purpose of this bill, is Attorney General enforcement. So to back out on that now is certainly surprising.
If I could just add. Thanks for the question. I represent the same constituents as Representative Zalesnikar, and I will tell you, if we remove the enforcements from this legislation, that means that Big Pharma will not follow the law as we're currently seeing. That's the whole point of the bill. I've been in meetings in our district in Lake County where rural hospital leaders have said, if we don't have enforcement and we don't remove the sunset, rural hospitals will close. That is a clear distinction. It is a clear direction from folks on the ground in northern Minnesota saying that this is needed. So my hope is that the House does pass the same language that Senator Klein has advanced here on the Senate floor with a bipartisan vote. 8 Republicans joined us on the floor of the Senate to pass this bill. There's no reason why a tied House should not be able to pass the same bill so that we can help save our rural hospitals all across greater Minnesota, but specifically in Representative Zalesnikar and I's district.
Can you address the Department of Health's findings that hospitals made more than $1 billion selling these discounted drugs for full price?
So that's actually how 340B works. The purpose of it, as established, 30 years ago by the federal Congress, was that hospitals would receive low-cost medications from pharmaceutical manufacturers, and then they would bill, private insurers or public programs at full rate, and the discrepancy there would be a funding stream for hospitals. So I don't think they're pointing out anything that's surprising or inconsistent with the purpose of the legislation.
What about, do you concur with Rasmussen's numbers that Fairview got $340 million, HCMC's at $100 million? And then, doesn't he have a point then about executive pay?
I can't speak specifically to executive pay, but I would say that Fairview is, like all of our hospitals, performing an essential function across the metro area and doing so on very tight margins and at risk of, not sustaining its operations. We need those hospitals to stay alive. They are not hauling in dollars over in the range that the Big Pharma is, and certainly Big Pharma can continue to fulfill their obligations so that they can keep their doors open.
Yeah, if I could just add, sorry, I just want to make sure. If Big Pharma wants to provide discounted prices to low-income patients, please, by all means, go ahead and do that. I would just add also that Fairview has more than hospitals in the metro. For example, we have an Iron Range hospital in northern Minnesota that is operated by Fairview. So this is a critical thing for both urban hospitals, HCMC, and others in the metro, as well as greater Minnesota. I just want to make sure that is clear. Fairview does have hospitals in other parts of the state.
Would you consider a bill that would require hospitals to report or, show how they spend the profits from the 340B program?
You know, I think reporting and transparency could be its own separate bill. It was offered as an amendment today and would have created a tremendous burden, bureaucratic burden on hospitals in this moment, and also would have generated costs for our state government to sort of process those reports. And for that reason, we didn't adopt it as an amendment. But as we've seen, you know, over the last couple of years, we should be watching where every single dollar goes in the state of Minnesota. And certainly, if this would increase transparency, that would be great. I will point out, though, however, that the federal government, this is a federal program, and the Trump administration currently has the power to demand audits of any 340B dollars that it feels are being misappropriated. It can ask Hennepin County Medical Center tomorrow to disclose where the dollars are being spent. That is their purview, this being a federal program. So if there is mismanagement of funds, it would follow to the executive branch.
Got time for one more. We need to get Leader Murphy's room back.
You done practicing medicine?
I gave it up. Did my last shift on February 1. I like to tell people I practiced for 35 years, and 120 of them were during the pandemic. So.
Thank you, everybody.
Thanks.